open? All right. Good afternoon, everyone. Welcome to the Montezuma County Board of Health. We will just go around and do quick introductions and approve minutes from October. I'll start, I guess. I'm Bobby Locke, the Director of Montezuma County Public Health Department.
Laurel Schaefer, Assistant Director of Public Health.
Katie Maxwell, Public Health Planner.
Jocelyn Hirschman, Medical Officer, Montezuma County Health.
Russ Maxwell, Assistant County Attorney.
Kent Lindsay, Montezuma County Commissioner.
Valeria, Montezuma County Commissioner.
Okay. Thank you, everyone. Did you have a chance to read the minutes from October? Everything good with it? No changes? Okay. Great. Okay. First on our, well, second, technically, on our agenda, we have listed non-compliant OWTS, which is on-site wastewater systems. And Linda, I'll kind of hand it off to you as to what we're actually going to do at this point.
I'm happy to report that two of the people that were supposed to appear today have paid their permit fees, and so we're good with them. We do have one outstanding non-compliant system that I hadn't mailed, and this is the Road CC property that we've been talking about. I would like to mail the letter to him this week. I've sent it to Stephen for his review. I talked to Stephen about having a sheriff's deputy deliver it as a notice to appear, because I have had zero response from this owner, and just wanted to see what you guys thought.
So that's one of the issues that I obviously came into your office to visit with you about. We actually were even contacted last Monday where we were in a meeting in Archuleta County about the same property, and it's getting worse, not only with environmental OWTS issues, but just with trash. It's becoming significantly worse. So yes, absolutely, but I want to know what your time frame is for a response, because I can tell you if it's less than 7 days, we need to make it at least 7 days, nothing more.
Well, I was originally hoping that I could have it delivered so that he would appear today, but we didn't make that. So within the next couple weeks, if we can reconvene as a Board of Health, is kind of what my goal is, because I've given him plenty of time.
Which is my point. We can reconvene at a Board of Health
Okay.
anytime, and we've made that known
Okay.
to all of our department heads that if you need us to get something fixed, we are here.
Okay.
So sooner than later, because we're getting multiple calls on this, and if you go out there, it is a
Lovely.
The thing that concerns me is this Board of Health. I don't know what we're going to do beyond the getting his septic permitted. We'll start with that. Okay. 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 Yes. Right. Right.
You gotta have 24 hours notice so we can post it. Yep.
Okay.
So thinking about, I'm not trying to leave it to our next topic, but on that next topic, there is a date of asking to be on the BOCC agenda for Board of Health on the 20th of this month, which is next week. So depending on when we can get this letter to the sheriff, when the sheriff can give us a window of when they're going to deliver it, we can add this up to 24 hours onto the 20th.
All I need to do is drop in the date, and I can get that. The letter is already drafted, so I can just drop in the date and then get that emailed over to the sheriff's office.
Okay, because we would just need to, like, if we're going to be asking for a spot on the BOCC for our Board of Health on the 20th, which is a week from today. So if the sheriff can make contact with this individual with the letter, then as long as it's 24 hours before the meeting on the 20th, we can just add that on. So ideally, we'll bring this back to you next Tuesday.
Yeah, I'll
if
jump on
he
it
doesn't
right away.
get served
That
and
makes sense. 'cause
produces what he needs to produce.
This is dragging on and it's getting worse by the minute.
So I don't see why we couldn't.
Yeah, and I've
tentatively
heard
plan for the
from
next
the
week.
public as well that there's been a couple people that have been sick, and I've encouraged them to see doctors, just so that they can document the illnesses. Now, whether they've gone or not, I don't know, but
Okay, so obviously I expressed my urgency the last time I talked to you on, I'm assuming, the other couple also, but it sounds like those have been resolved to a certain degree. Maybe?
yes. So the other two. Being challenged with the mic. The other two, they have applied for their septic permits and they have paid for it. So
So my next question to that is, are they already installed and were they ever inspected prior to just applying for the permit?
So the
Because-
one person that I believe has other possible issues within the county, I don't believe he's installed that septic system. In fact, I talked to the engineer today and a couple days ago, and he's like, I can tell you, I never did a final inspection on that because the engineer's design was in 2022. And when I asked the wife whether it's been installed or not, she could not recollect.
But the other one that was resolved has been inspected.
It has been inspected.
We've done all of that, and we actually made a site visit, and
Yep.
they paid.
So the other one's
So
good.
that one's good,
Okay.
yeah.
I'm trying to think of how to say this.
I can do a drive-by with the one that,
You know
the
one that's in
individual-
question here. and
Yes.
That's my concern because of the information that I'm getting from the neighboring bodies is that it has already been installed and it was never inspected by the engineer or us, and it's there. So
but
my
there's
concern
okay.
is that if it's already there, just because he bought the permit doesn't mean it was ever inspected.
Okay. So then I'll take it a step further.
I guess that's
Yep.
what I'm saying.
Okay.
Or that's what I'm asking.
Okay. Yeah. According to the engineer, he did not do a final inspection, and I was not in that role.
And he would have only done a final inspection if he got a call.
Right.
So if
Correct.
he never got a call, that's why I'm really suspicious here. And I'll just say it publicly. I mean, it's a suspicion of, I want to make sure this is done right because we're getting a lot of complaints from the neighboring bodies.
So I
Don't
can
know how
ask
we-
them. I'll have them I'll have them get it inspected with an OWTS certified inspector so that they can demonstrate that it'll pass. So I'll contact them. They won't answer my calls, but I'll text. So, I mean, that's what they've been responsive to.
Okay.
Okay, so we'll move on to the third bullet point, which is if we have any public comment regarding Regulation 43. Unless, do you have a comment? Okay. I just thought I'd check in. I know, you're Katie's mom. I know. Okay, so, and Linda, at this point, is there anything that you need to say about the Regulation 43 other than when we want to tentatively get it adopted?
So we need to do a public notice for 30 days. So that 30 days ends on January 15th of 2026, which is why we're requesting to do a Board of Health so that we can get final approval, and then I send it to the state for their final approval.
Right.
So,
So if we can get a spot on next week's BOCC for a Board of Health, a couple minutes. I know, what did it take you, 10 minutes today?
11.
11. So, yeah, if we could get a spot and maybe leave a little extra room in case we come through with this other situation. Morning for me, preferably. Does that work?
I'll make whatever works.
Morning is better for me.
So from what you presented last time for Regulation 43, there really wasn't any
No.
real significant changes for
No.
us.
No,
Um,
very straightforward. I mean, pretty much operating the same. They expanded some of the soil definitions, but that's really an engineering, but nothing really impactful for us.
And did we have any calls or questions
No.
about it? I
In
didn't
fact,
think
I
we did.
believe we only had one person show up in our office today asking for a copy, and I thought she was going to be here, but I don't see her, so. Because I had it up there for, if they wanted a copy.
Yeah,
or-
we had it at the front desk.
From what was presented and we talked about,
Mhm.
there's nothing, it's pretty
No.
straightforward.
No, it's very straightforward. Pretty much everything stays the same.
Right. This is just the way it's written in statute, that you have to give
Yes.
it the 30-day
Right.
notice, and so we're at that point as of, would you say, 15th?
The 15th
Yeah.
of January.
So as of the 20th, we could have it approved. So,
And then you go through a few hoops with the state, and then it's official.
Okay.
okay. All right. So I'll just move on to our communicable disease update. Probably the thing that comes to everyone's forefront would be the measles situation. And right now, nationally, as of the end of December, there was over 2,000 confirmed cases nationally. We had 4 here in Montezuma County in November and December. Basically, the other thing that was going on, so as of January 12th, no further cases for us. The wastewater had been being monitored. That was an arrangement that CDPHE contacted the Cortez Sanitation, and they agreed to do an emergency water testing during the measles situation. So our most recent result I received today, which was from January 8th, and it's negative at this point. We did have positive wastewaters when we were having the measles cases. It's really sensitive. I'm not exactly sure how the testing is done, but it is super sensitive. Like just one case will show up in wastewater. So it's pretty impressive. So, but they are only monitoring for measles, nothing else.
I have one question. What if they don't live within the jurisdiction?
Then we don't pick it up. But chances are they might go to school in town, or they shop, or they go to a restaurant and use a public restroom. It would show up. So you could potentially, but we have, as we know, way more people living out in the county and on septic systems that you're not going to pick up. Right. So anyway, and it would also pick up someone traveling through Cortez who had measles. It would show.
But they didn't do the other, like Mancus or Dolores's
No,
system.
no,
Just the
Cortez.
CSD.
Yeah. So, and again, that was done. We were not part of that. That was the state contacting the district, because we had brought up this possibility during COVID, because that's when they started testing wastewater, and at this point, I did find out. I asked this question today: are they only currently testing for measles? And they are only testing for measles. They're not testing for anything else.
So the test only tells you if it's positive or negative. It doesn't give you a concentration of, or can it give you concentrations of, you've got a lot of
It
influx,
does give
or
you,
what is it-
from
what does it
my
give you?
understanding, and again, I don't fully understand the science of it, but there are numbers, and the numbers correlate in some fashion, but if the numbers are lower, then it's like you probably just have one. If they go up a little bit, then you have a significant increase in your amount of potential measles that has been put in the wastewater. And so typically it shows up in wastewater before you actually find sick people. So that was why they instituted it during COVID, because wastewater was testing positive before even we were getting COVID tests. We did not do it here, but I know Mesa County did, for instance. So, and it was historically 1 to 2 weeks before you would actually get a positive person. So, but it actually, the turnaround is pretty quick with measles. I mean, it's like real quick in the wastewater.
What all can they test in wastewater?
They test for, gosh, I know with COVID, I'm pretty sure they can test for flu. Don't quote me on that, though. And then measles. And I'm sure there's other things that they can test for. So it's different ways that they do the testing, too. For measles, it's not just and Cortez could probably tell you more, but it's not just a scoop and send it. There's more, it's like a trickling.
Yeah.
It takes more manpower to do what they've been doing for this measles. So, but they're only sending it in, I think, once a week. So, but it gives you it's a tool to monitor what's going on in your community. And the past several have been negative, and they were positive. So, this.
Do you know how long they intend to
Tomorrow.
continue testing?
Yeah, tomorrow, and that will be the last one. We'll get the result in a week. So, and then they will stop, because then you're basically beyond the period of incubation where you could get another positive from the existing positives. Now, that doesn't mean we're not going to get another positive, but they're not going to be ongoing testing after the emergent part is over. So, yeah. So, anyway. So that's kind of where we are with the wastewater piece. Arizona is still really experiencing a lot of measles cases, particularly the border with Utah. Mojave County has 200 confirmed cases, so since December 30th. And then Southwest Utah has 114 since December 30th. So.
Sick people over there.
Can I just add, I did the math today, and it took one nurse over 80 hours to do one case.
Yeah, measles
So-
is...
And there were 2 nurses on each case, so we actually had an entire
Yeah.
160 plus hours
Yeah.
to monitor one case. Now, that doesn't mean just that one person. It means connecting all their contacts, putting everything in the system, tracking those contacts, and doing all of that kind of outreach.
And it's daily. We had to check in daily with everybody and monitoring them for 21 days. So it's a lot of work. Measles is it's definitely more time consuming, and just the investigation part is far more time consuming than COVID ever was, just for 4 cases in this county. So yeah, it took a lot, 7 days a week. So.
Hopefully you don't have another case.
Yeah, we're really hoping not. So anyway, the vaccine recommendations haven't changed. Nothing has changed as far as, the MMR. It is easily available. We will administer it. People can just call us and we will make an appointment with them. We'll run out to the car if we need to. We'll do whatever we have to do to get people vaccinated if they want an MMR, or if they're behind, or if they don't know the records, just call us. We will check, find out what we can. Contagious period is 4 days before the rash and 4 days after the rash, and oftentimes your person who's actually the measles case is out of isolation before all the contacts are out of their quarantine. So it's confusing, but that's how it works. So, because it can take a while to actually convert to be positive for measles and contagious. So, any questions about measles? And Dr. Hirschman, if you have anything to add, please do.
To add, but I was curious, any more measles in the surrounding counties?
In Colorado, we just had our our Southwest Circle Four Corners meeting this morning. Nothing in La Plata. I think we would have been told if it was in Archuleta and San Juan. They were not on the call, but our regional epi from the state was on the call. And so nothing in the moment brewing in the Four Corners area. So, yeah, for our state. Now, that doesn't cover Utah, New Mexico, and Arizona.
And do you have what our MMR rates are for
Oh, I
vaccines?
did not bring
Okay.
that. I'm
I was
sorry.
curious how
Yeah,
they're-
no, I don't have it. We're actually not that far off. I mean,
91.
yeah, we're really not that far off. So, but the cases we had were unvaccinated.
Yeah.
I mean, definitely unvaccinated people are at greater risk. Or those who fall in the years when the vaccine was not effective. So, yeah. I can get you those rates, but I don't know them off the top
I
of
was
my head.
just-
And I don't want to quote
Wasn't sure
numbers
if it was
unless
right
I
off
know
your
them.
head or not. Thank you.
So also on this call, we talked about flu, and Colorado is one of the highest right now. And actually, there's apparently a map that is live, and you can see from the CDC the actual flu cases as they have increased over the season. And Colorado was the first state to start to go up. We've been hitting the top in every stage of the flu. Locally here, we have had 2 influenza cases that have been hospitalized. So, I mean, it's not good, but it's not terrible. And RSVs, we've had 1 hospitalized and no COVID's hospitalized, but we have had 100 cases of COVID locally. So, in the state of Colorado, hospitalizations are high. There's over 3,200 people that have been hospitalized with the flu, and 279 hospitalized with RSV. So definitely flu is every day increasing.
Is that more elderly or is that more youth?
I didn't break down by age, but I don't think it's necessarily any pocketed in any one area.
Yes.
I think, and it's my understanding that the strain that they're seeing is not completely covered by the current vaccine. So, but they're telling you that the current vaccine is still going to help if you do get the flu of this new strain. It's still going to help you be not as sick if you have the flu vaccine on board. So they're encouraging people, if you haven't gotten it, the flu vaccine yet, get it. It's not too late to get it. So anyway, so that's kind of.
I know, it's kind of
What?
sitting over here going, like, it's giving you the stink eye.
Guilty conscience? No. So any questions about RSV, flu, any of that? No? Okay. And then my last piece here would just be animal bites. I always report on animal bites. We've had 24 cases in this last quarter. Last quarter we had 22. It's just an ongoing issue. And we continue to educate people as best we can. And then our fentanyl and Narcan distribution, our fentanyl test strips, we've given out 50 in this quarter. And Narcan kits, we've given out 111 this quarter. Both of which are down from the last quarter. We had given out 80 fentanyl last quarter and 141 last quarter of Narcan. So, any questions?
Was there any dates on the strips as far as their
Expiration.
expiration dates?
There are on the test strips, and we're no longer getting any more of those. The funding basically is done for the test strips. We give a lot of those out to our partners. We give them out when people walk in and want them to, but we give a lot out to our partners. I can't remember the date on them, though. There is an expiration date. It's a little, we got some time, though. They're still good. That I know. Narcan has expiration, too, but Narcan, you can keep giving
It's
it.
pretty long for.
Yeah, and you can still give it even after it expires, Narcan.
Is
So
Narcan susceptible to heat, cold, freezing?
they say you can leave it outside.
Okay.
It's
I mean-
also not dangerous.
Mhm.
Like, if they're not suffering from
Right.
that and you give it to them, it's not dangerous.
Right.
to
If
them.
you think they need it, but they don't need it,
For,
it's not going to hurt them.
for us, if they were unconscious, it was Narcan B50, and then we were done. First.
Yeah, but you can keep it in your car. I encourage people to keep one in their car. So anyway, that's what I have for communicables.
Rabies. Had any rabies stuff?
I mean, we're constantly screening for it when we get the animal bites and educating
Right.
people, but we have not had any cases. Yeah.
What are the most bites? Dogs? Still?
I would say. I don't have it divided up, but it's mostly dogs. We get cats too.
Well,
Cat bites are really nasty, but most of them are dogs. Yeah. Yeah. It's a lot of educating owners. So, yeah. If we can find the owner.
yeah.
It's not always possible. So, and then the person needs to go for treatment. we recommend they go for treatment anyway.
Do we track how many people are getting treated?
Yeah, that's in our database.
Okay.
Yeah, it's in our, well, it's now, it used to be called, it's called EpiTracks now, the new
Okay.
term. Yeah, but that's in there. When we recommend that they go and get their treatment, we track that. So, yeah. Yeah, and actually we're, and oftentimes we do have trials and tribulations with transport, getting animals that we
Yeah.
need to test for rabies, but I do believe that the state has a pretty good system right now with the current courier that we're now using. It's worked well even for some of the things that we've had to send to the state in regards to our measles issue. So the courier system has been working really well, so which has been kind of nice. So there's nothing overnight down here.
No.
And then when there's a storm, it creates problems. So, okay. Any other questions?
Because it all goes to the Front Range? Just
Goes
like
to
we did for
Denver.
COVID?
Goes to, huh?
Yeah. So why can't we get something on the western slope?
You'll have to ask CDPHE that.
Well, that's
I have
like
no idea.
asking that.
I might as well ask
rock
that
wall.
table, yeah.
No, it has to go to the state lab. If we work with the state lab, it's free. So that is a lot of times why we send things to the state lab. If you send to a private lab, somebody's paying for it. I mean, somebody's paying for it through CDPHE too, but you know, the individuals don't have to pay for it. So if there's human interaction with the animal, if we're talking about animal bites. So, yeah. Okay. Okay, so that's for communicables. Now we are on to our presentation of our final public health improvement plan. Katie Maxwell, drum roll.
I'm up. Okay, well, this is a big deal to me, at least, because we've been working on this for 2 years, so it's a culmination of a lot of work. I'm going to hand these out. Do you guys need?
No, I don't.
So let's just pass these down. I think that should be enough. Travis, would you like one? No, I'm good. Okay. If it's not, let me know.
And I just want to say, before we get started on this public health improvement plan, you probably already know, but this is Katie's last day is tomorrow, and Katie has done an amazing job working with us in the health department. We're very sad to see her go, but she has worked really hard on this public health improvement plan. She did an excellent job. She worked with community partners. We facilitated lots of meetings. I think we've come out with a really good product, and I will credit Katie for doing that. So she's been a great employee.
Thank you, Bobby.
Yeah.
Yeah, and I also want to credit, it has been a huge collaborative effort. As you know, we've talked to probably, I don't know, at least over 800 people in the county about this project. So, and yeah, it is a big deal to me, which is why my parents are here. So, hi, Mom and Dad. And my brother decided to show up too, so got the whole family. Okay, so just a little reminder and refresher, maybe for people that weren't here. This project started out 2 years ago by the state of Colorado. We are required to do a public health improvement plan every 5 years. And so what this looked like for us was we did a community-wide survey. That part is called the Community Health Assessment, and you probably remember me presenting that to you about a year ago, actually. And so we did this community-wide survey, and it touched on about 30 some different topics, and we were trying to get a feel for what were the most important topics that the community was experiencing from their own perspectives. What are the biggest issues they're having to deal with? And so based off of that, we then pulled some external information, secondary data on rates of disease and things like that. And so I put all of that into one report, which was the health assessment, which we've talked about quite a bit over the last year. And so the next step is, what do we do with all that information that we collected? And it ends in a public health improvement plan, which is our 5-year kind of strategic plan. So I will go ahead and have you open to, there's an introduction kind of about, a little bit about how we did this. And a really key piece of creating this public health improvement plan was, I also want to acknowledge we were guided really well by our advisory committee of representatives from other organizations in the community who volunteered their time to help with this. And we all decided in that group to have a community listening session, a stakeholder session. And so the number one topic area that came out of the health assessment was behavioral health, which we kind of divided up into mental health and substance use because they have a lot of overlap, but there are also unique needs for each of them. But you'll see in the health assessment, the public health improvement plan, that our first goal out of our 2 goals is to reduce substance abuse and improve mental health in Montezuma County. So we specifically reached out to folks in the community who work directly with people that are dealing with this and people that have lived experience. Most of the people in this community listening session had their own personal lived experience with these issues. And it was an incredible meeting. We had it facilitated by an external facilitator, and they gave us, this group of people, their insights and life experiences living here and dealing with these issues on the day-to-day and helping and support other people with these issues was really amazing to get their input. And so all of that came into this final report here. So I'm not gonna go over all the details, but I do kind of want to let you know what the basic areas are. So on page 3, we have goal 1, reduce substance abuse and improve mental health in Montezuma County. And that has 3 different target areas. So the first target area is prevention and early intervention. And if you know anything about public health, you know we live in prevention. We want to prevent things before they happen, right? So that is the first thing that comes up in this. And education, as we often talk about, is really a huge piece of this, providing education on the risks of early exposure to substances, and also providing support for parents and guardians, because we recognize that substance use exposure can start very young in elementary school. So, and again, I won't go into all the strategies, but feel free to look through that. The second target area was cultural and social norms, and this was something that the stakeholder group, the listening session, really talked about, increasing awareness of how substance use, how mental health intertwine, and how they influence behavior. And so in this section, we really want to partner with other community organizations to promote healthy, safe local events and places. And there are already some groups in the community that are working on this. This is also where we are going to be wanting to talk to our partners consistently, if they're reaching out for things. Like, I know we had a local partner reach out recently saying, they needed more Narcan, and so there's things like this. This is the area where we really want to listen to our community partners and the public and what they're telling us, and making sure that we are providing the response that our community is needing and asking for. So there's some youth-led pieces in here as well. Youth came up a lot. If we flip to the next page, we're still on that first goal, and we're still on cultural and social norms. And again, there's more education in this one. I think you're probably going to see education in every single one of the target areas. And one of the things here was trying to meet people where they are. So one of the conversations is, how do we get to parents, especially we've seen that parenting classes and parenting groups are not necessarily well attended. People are really busy. And so one of the ideas from our stakeholder group from our advisory committee actually, was to try and have find an existing campaign where someone who's already a parent who's already on Instagram or already on Facebook can get, a 1-minute snippet of education that's already built into their day. They don't have to try and find childcare and go out to a parenting group or something like that. And then we also have print ads, movie theater, flyers. There's other ways to do this as well. Okay, and then the third and final target area for the first goal is collaboration and provider support. And one of the amazing things about this listening session that we had was there were people in the room that have been working across Montezuma County, kind of in this substance use realm, as well as mental health, that hadn't met each other before. And so something they really asked from us was to continue having these conversations, to hold regular meetings, to provide a space for these actual providers. And you know, we're not talking about the people that are the directors of programs or the CEOs. We're talking about the people that are doing the work with clients on the day-to-day, and them needing that support and that connection with one another. And it's a combination of resource sharing. It's a combination of being able to together think and brainstorm what we can do as a community to make our prevention system more robust. So one of those strategies is holding regular meetings with that very group of people. And then also increasing community knowledge around what are the local resources, and trying to streamline services, because something we also heard was that coordination of services can get a little jumbled sometimes. So I'll pause on that first one before I move on to the second one if there are any questions.
Go ahead, and then I have some questions.
Okay. So page 5 is our second goal, which was the second top priority to come out of the big community health survey, and that was improve food security and access, supporting local food resource providers and initiatives. So there's actually a lot of work going on right now in this realm, and so the health department's role is really going to be more just supportive of making sure those, you know, we're at the table when those things are happening. We're not necessarily like a lead in this, but we want to acknowledge that this was a huge need that came up in the health assessment, and that we do have a role to play. So this includes attending local food security collaborative meetings to identify ways we might be able to help. It's also talking about food access services within our health department programs like WIC. And then it's also seeking out additional funding opportunities to increase food access and applying for funding. So that's kind of the second goal there, and that is really the meat of our plan for the next 5 years. The conclusion will mention that we also plan on having an annual report that will explain kind of our progress and what we've done over the last year. Things will definitely shift. I mean, last time, I wasn't there when we did this, but last time we did this, COVID happened and kind of threw a wrench into everything. So we know things will shift, but we also have a plan, and we have some pretty clear goals of where the community is asking us for support. And I won't be here, of course, but I will say my wish is to continue, for this work, is to continue having these conversations, especially at the Board of Health meetings. I think it's really great to talk about what our community partners are coming to us with, and making sure we're really looking at everything that we're being asked to do and how best we can deliver those things, what funding we can apply for, if there are other ways that we can support, because we've done a lot of work to build this communication back and forth with the community. This was just a start. I mean, obviously it's a lot of surveys and a stakeholder listening session, but we are constantly communicating with the community, and so making sure those voices are really heard when we're having Board of Health meetings, and that we are addressing the needs that they're actually asking for. So that would be my hope for it. Now, any other comments before we questions?
I feel like you may ask this question, so I just want to chime in here. You know, when we're looking at these target areas and these goals, it's really working in public health for the last 16 years and being a part of several of these. It's really cool to see it come together, and you know that you're on the right track. So for example, like goal number 1, that is why we applied for the grant funding that we applied for 2 months ago. It would support this kind of work. And for like the food securities piece, we've already been approached because they need some help. They need administrative help. And so we are sitting at these tables. We are hearing this, and then it's really cool to hear the public relay that back to us, like this is what we need, and we feel like, you know, we're on the right track. So I just wanted to add that. We are already dipping our toes into 2 of these things so that we can continue to move forward.
So, the partnering with the other community organizations, what really do we have in this community, in this county? I mean, I can think of a couple, but how many do we have?
What were you asking? How many what?
Like, how many other community partners do we have to try and achieve this goal? So,
Oh my gosh.
I mean, how many do we really have?
Well, we applied for funding with 2 of them because they are the experts. They are the youth experts. And so that's where the health department has the advantage because we can see, we can administer a program and we're not necessarily the 2 experts that are working with youth. So part of the EPIC grant that we applied for includes $150,000 to support SCYC and Team Up, who are actually doing these youth services. So,
Yeah, and I'll just say on our collaborative groups like the Safe Suicide Prevention Coalition, Healthy Montezuma, obviously the different work groups we have, there's probably 40 partners that we regularly work with. So public health is incredibly collaborative. So we have to do this in combination with other.
So then we'll be able to look at the plan and how do we quantify it? So do we have the data of what we're actually affecting and touching and actually achieving a goal? I mean, how do we
Yeah.
how do we gather all of that?
So-
at the end of 5 years, we're going to know where we're at.
Yeah, good question. So
How do
we have.
measure success?
How do we measure it?
We have progress measures and outcome measures. So progress measures are things that you want to, and this isn't in the public health improvement plan, but I'd be happy to send you this. This is more of an internal document. But so like progress measures are the amount of communications materials we share. For example, if we're having public health or some kind of campaign about substance use prevention. And then an outcome measure might be like an estimated reach of people that we actually reached. So there's different measures for each one of these objectives and strategies so that we can see, are we having any impact? And again, this may also evolve with the plan, but that's kind of the starting point.
Do we include municipalities and school districts?
Yeah, if it makes sense, we definitely would, yeah.
And as far as getting in with the school districts, that SCYC
Yeah.
is kind of our key link for working with, because they have a very good rapport already with a lot of the student body. So that's kind of our linkage for
Does
that,
that
for the
link
youth.
go into the charter schools? Okay.
we're actually really welcome in SWOs.
Yeah,
Okay.
yeah, we're in SWOs for a lot of different events
Okay.
from the health department.
And the only one I can't think of is homeschoolers. Is there a reach to them? I mean, that would be difficult.
Yeah, and I mean, it's a good question for SCYC actually, because I know the homeschoolers have groups that
Yeah.
they affiliate within their
Right.
community. But there may be a way to, and I don't know who that point of contact would be. We'd have to do
I
like a
don't
little digging on that, and maybe SCYC might know
Yeah.
when they meet, who runs.
Well, and I think
That's a link I don't know.
A lot of that is the funding that we're waiting to hear if we can get. If we can get that supportive funding, then we can do this work and we can get it out and do what we need to do. If we don't get that funding, we're going to have to find another way to be able to do this work. So,
And
I
as
mean-
far as other organizations that we partner with, I'll just speak on behalf that we just heard from one of our partners that they're seeing increased usage of fentanyl, and they would like to have Narcan more available. So, that kind of thing, we have people reach out to us all the time, and we just recently, within a week ago, got that
Can't they get
request.
Narcan though? I mean,
no, it's
or is it
about
just through
$50 a
public
box.
health?
It's about $50. And we get it for free. Well, free.
Right now, we have a
Yeah.
supply.
Right now. we do.
There was an opportunity, but we didn't pursue it.
Yeah,
So, you know, it is a funding issue. I mean, we do, you know, we totally can provide the Narcan as long as we have it. We do, but it's just like the fentanyl test strips, right? I mean, eventually the funding runs out, and I know the Narcan funding is probably going to run out. Right now, we're all in, and we're getting it when we can, for sure. So, and then passing it along. So, but you know, it's only as good as we're open to. That's the other factor. So, but we do, you know, we do provide it to partners when they need it.
So do we have any
and
data
individuals.
as far as the administration or has it been administered from what we've handed out? Do we know how, have we saved?
That's one of those data
I mean-
points that's you know, you don't.
You
I
can
mean,
hand
I've
out-
given a lot to the sheriff's office, and
Well,
then
yeah, I would-
periodically,
I
and
would
they're
think
giving
the
it out
sheriffs,
too.
the fire departments, so on and so forth.
Right,
They're gonna
and-
have the absolute most possibility
Mhm.
of encountering somebody that's
But
overdosed or
it's,
something.
you know,
but-
it's nice for the average layperson who isn't involved in law enforcement to be able to have access to it too. And so having it in different places that they can have access to it is important, you know.
Do the school clinics have access? Do you know?
You know,
doubt
I know,
that
well, I know SWOS does.
Okay.
I'm not sure, because the school-based clinic at RE1 is hospital. I don't know. I don't
Okay.
know if the hospital has provided them Narcan there. I honestly don't know that.
Because I know SWOS has a clinic in the high school. Does Dolores have one? Okay, and Mancus?
So,
Yeah, but I don't know.
Okay.
I don't know about their Narcan supply.
Yeah, I don't,
We would totally give it to them though in a heartbeat, so
Okay.
they can
Yeah.
have whatever they need.
It's
you
one
know.
of those things that's like hard, like, you know, suicide prevention. You look at the suicide rate and see like if it's going down, maybe you've had an impact. Although with Narcan, for example, like in La Plata County, there was a teen who was able to save his friend's life.
Right.
And I believe that was Narcan he got from a kiosk.
Yes.
So like there are instances where you know that, but for the most of it, we're just hoping that eventually the rate goes down and we see things like that. So.
And
so I'm
that's
gonna,
what I was
I'm
gonna
gonna
say too.
switch the conversation here a little bit because obviously, you know, my biggest deal, because I watched it and seen it on a daily basis, is alcohol. Alcohol is still the biggest abused
Oh, yeah.
subject that's out there, and we never talk about it anymore because it's just accepted. How are we dealing with that? And that's prevalent
that
40
goes
years
right-
ago when I was a
yeah.
kid, 50 years ago, maybe 60 years ago, you know? But what are we doing with that? Because that's what we never talk about. And that's what's so, it's here.
I was like, well, that reaffirms our number one goal. So thank you.
Yeah.
That substance use and alcohol is really
the
the number
number
one. Yeah.
Still.
Which we have in our CHA, which was like, you know, we have a really high rate of people dying from alcohol-related liver disease in this county.
Right.
So when we're having that community listening session, we're talking primarily about alcohol. There's other stuff for sure. But yeah, that's what is built into this plan, is continuing to have these conversations with the people who are living in recovery or living a life where they are actively being a peer to others or they're a provider. So, yeah.
And I'm sure you guys are all aware of what SWORD is, right?
Yeah.
You know, and being part of that since the beginning, you are able to see like the need, and you're right, a lot of that is, but that money is driven by opioid money, so it always has to be a part of what we do. However, the prevention methods that they come up with can spread out to other substances.
But, I
So-
mean, how do I term this? The layperson, that's a bad term, but a lot of people don't associate alcohol as being a substance. They differentiate that. And so it's not included in substance abuse. I mean, it's alcohol abuse, and then they think of substance abuse as drugs.
Well, and I think that's a lot of our, the educating the youth as well as adults. And again, we have some hopes if we get this funding that we can, you know, do a little more of that than we normally have. There's no funding to do this type of thing, and when you do apply for the funding, like, you have to kind of braid it to make it work.
Okay.
And so
Yeah.
that's what we do.
And we've talked about also when we had our planning meeting, if you remember back when STEP was in place, that was the tobacco education program, and they were in the schools, and we used to educate youth, and the little kindergartners would go home and talk to their parents about, you know, mommy and daddy, those cigarettes are not good for you. I mean, that kind of mentality where you teach them at a young age, and that would be ideal if we could turn alcohol usage into something like that. Because the earlier you get these youth to believe in what making healthy choices, the better. You know, it's not just,
Right.
you know,
It's
dealing with the
prevention.
30-year-old. It's the 4-year-old, the 5-year-old. So, yeah.
There were a group of teenagers from Montezuma Cortez High School, along with an adult, that came in for a retail food application. They have what they call a sober bar. And so it's like mocktails, and they wanted to promote not drinking alcohol and that drinking these mocktails can be cool. So I was kind of excited that there was a young group of kids in our area that wanted to promote that. So there are kids out there and parents that are like trying to get involved with that.
Well, and I do think, I mean, there is evidence out there that drinking is less prevalent right now.
Yes.
It like our 20-somethings, they're looking for something else. And so we have to encourage that. But we also have to think, in coming from a public health perspective, the trauma that people are exposed to in our communities that cause the substance misuse is it's a result of trauma. And that's where the behavioral health piece comes in, the mental health piece comes in, and we have to be involved in all of that. It's not just, you know, there's a lot of trauma here that there's underlying things that we're all trying to tackle. So that's another piece.
And with all of this, public health work is slow. It is not something that you're going to see change in a year. You're not even probably going to see it in 5 years. You might see it in 10. That is just how it works. I mean,
I understand that.
so
Trust me.
it's not something that we're going to, you know, we might be able to produce a report in even in a year, you know, an update. Where are we on what we're doing? If we make a shift by a 0.5 of a point, hooray, you know, that's good, because it takes time to make, because you're talking about changing human behavior. So it's a big thing.
Cultural
yeah.
change, I understand.
Yeah.
that. Trust me,
yeah.
I work in government.
Yeah.
I understand that everything is slow. I work
So,
with attorneys.
yeah, it is
Nope,
just,
nope.
it's, Gus is the exception.
Yeah, that was
But it
part of our
is, it's
conversation
just,
earlier.
it's a slow process, and, you know, that's why, like, when we do these public health improvement plans, you know, 5 years ago, it was, you know, behavioral health umbrella of mental health, substance use, that was what we were targeting. Then we're right back there. We're right back with the same
Well, that's
issues.
good, because if you guys can see that there's a reduction, because I still see the alcohol everywhere I go, to all the meetings I go to, is still, you say it's reduced, I don't see that, but maybe I'm just not in the right.
Are you?
At a certain age.
Yeah,
It's-
I'm like,
it's a
are you
certain
hanging
age
out with a
Oh,
20-year-old?
Yeah. Nothing personal, Jim, but I think you're a
I'm
little
not
old
hanging
for
out
it.
with the 20-year-olds
I know.
at all, but,
Yeah.
you know, it's still, that's what I see.
Mm-hmm.
And it's just accepted by everybody, and I'm like, you
But-
know, I can remember when 2 years ago, the state law, and I can remember raising my hand, the only one in the room of all the counties voting no for being able to have liquor now delivered to your house. The state law, oh yeah, it's a great thing. Everybody just get all your alcohol. I'm like, this is stupid. What are we doing? That's my point, is like, when do we, that's how you educate it, but we as a state, voted by all the counties, like, yeah, let's make a state law that everybody just get all your shit delivered to you because of COVID. Oh, you know, it was because of COVID. Come on. It's still a state law. Hasn't been rescinded, and it will always be there.
It was supposed to be temporary.
So all the temporary stuff is not temporary. But temporary could be 100 years. It's still temporary, right? So
I think
it's
those
just
are-
a bunch
that's
of
half the battle.
Yeah.
is-
bureaucracy and
Yeah,
Yeah.
that's half the battle doing this type of
BS.
work.
But
Yeah, and I just want to emphasize too that the culture you're talking about around drinking and it just kind of like being the water that it's like it's not an obvious thing, and that's so much of like the events that happen and everything are centered around alcohol. And so again, that's a slow shift, but you know, we have these things built into our plan as like goals, is that we have more spaces that are alcohol free or the focus is on something else. So I mean, you're seeing the same thing we are, and I think that's good.
I'll tell you a story off of here. You'll want to hear this. But, you know, when we think about how do we know that we're making an impact, if you think about our suicide loss rate last year was the lowest we've seen in a long time. How do we know what contributed to that?
Yeah.
We don't. We don't, but we continue to do the work that makes sense, that creates healthy behaviors, healthy mental health, and and also what works in our communities. So,
well, I mean, good. I think that's good, but again, I would just like to see alcohol more focused on, and I know it's just a part of it, it's just a component of it, and I get it, so I'll stop
And
from there.
in our survey, I mean, you know, alcohol is in there
Yep.
with,
And
as
I-
a substance,
and I know
and
that.
so
But-
but you're right. I mean, people don't always think of that as a substance.
It is the
And,
worst
and,
substance,
no,
in my opinion.
the data
Well,
supports
it's the
that.
most widespread. Like
Yes.
it's impacting the most people.
Yes.
So,
Correct, because I can almost tell you every call I ever ran was the key element, every time. And it didn't matter what, it was a car wreck or domestic or whatever the
Right.
call was, it's like, guess what? Friday night.
And a lot of times when there's polysubstances,
Yeah.
alcohol is one of the substances.
Right.
So, you know, it is.
How do we,
It-
yeah,
Just
Okay.
keep plugging away at, when we get opportunities to get funding to target certain things, we go for it. And doing the work we do, hopefully we should be hearing soon on that EPIC grant. It's supposed to be January, so hopefully we will hear soon if we're going to be getting that. But, I mean, you know, it just takes a lot of work to get this information put together, and a lot of individuals kind of pouring their stories out there.
yeah, no, I think the plan is great.
so,
Thank you, Katie.
yeah.
I appreciate that. I know we've had a lot of conversations.
Mm-hmm.
But at some point in time, it's just like I was telling our attorney this morning, is like, when are we going to ever see, and I get it, that it takes a decade to see any kind of a change, which I struggle with that sometimes. And I know that it's just the way it is going to be, because if you're changing a culture, you have to, it's going
Yeah.
to take a
Right.
decade.
If
to
we're
do
that frustrated, how frustrated are you?
well, it's hard. I mean,
It's very
prevention
difficult.
work is hard because it is really like you never get to know that you actually like saved someone's life or something.
Right.
And that's why we have these little wins of like how many people did we connect with. And something that I keep thinking of as we're talking about this is I think our suicide prevention coalition has been around for about 5 or 6 years. And so the Rise Walk will be having its 5th year this year. And last year we had almost 350 people. And that has just continued to grow every year. And so you maybe don't get to see the big numbers, like, okay, there's a huge drop in, you know, alcohol use or whatever. But what you do get to look at is more people engaging around these conversations and
Right.
the culture starting to shift. And so you kind of take those little wins along the path while you're hoping to get to a bigger one.
And when you look at the suicide numbers, if you just look at the numbers of it going down, and you think about all the things, all the activities, all the organizations, all the work that goes on in the community over the past year that are focusing on suicide awareness, those all are contributing factors as to why the numbers are down. So, you know, Rise Walk being one of them. It's an awareness thing. People are more aware of it. They're more willing to open up. They're willing to share that they're in trouble. They need help. They talk about it more. There's less stigma attached to it. There's all these pieces of it that are going on. And those are all the wins that we look at in public health, that these are all good things. And just because we don't see a major shift in anything, it's like we're in the right direction.
If you can see it going downward, then I'll settle.
Okay, we'll talk in 10 years.
Yeah.
I just, I just say, because I've watched it for so many years, and I'm not saying don't have a drink. I'm not saying that at all. I'm just saying the abuse of it, because that's where you get more problems down the road or with your choices in life. I mean, it just creates all kinds of bad things, typically. But I'm not saying most people's personality is like, I'm going out tonight and I'm not going to go just have one drink, man. I'm going to get hammered. And that's like...
There's a lot of people with addictive personalities.
Yeah, and we probably all have
Like Laurel
that.
said, trauma, some people have been through a lot of trauma, and you have to cope somehow. So we're, part of it is like, how can we get different, more supportive coping mechanisms to people when they need them?
The great outdoors.
And I think
Everybody out in the
I
great
think almost
outdoors
everybody
again.
has some sort of addictive problem. I mean,
Sure.
humans
Yeah.
are
I'm kind of addicted.
Definitely.
I'm addicted to food.
yeah, well, I'm in that club.
We're
So
all-
I mean,
we all have an
we all
addiction,
have
yeah.
our struggles for sure. Some are obviously a little more detrimental to your long-term health than others, but it's figuring out a way to make the shift. And I feel like we're on the right track. I think I'd love to hear what you shared, Linda. If we've got youth that are looking at mocktails, we've got a business here in town that has mocktails on their menu along with their alcohol menu. I mean, there's probably more business. I don't go out a lot to eat, so I don't know, but I do know the one place that I've been, and I think that's great that there's options and it's openly acceptable to go out and not have a drink now. If you
yeah,
don't
and
want to.
Again, don't get me wrong, I'm not saying,
So, right. But
if you
having
can
it be
control it, to
normalized that
have
it's okay
one
not to drink
or get
too.
a ride or something. I'm just saying,
Mhm.
how do we get the responsibility back into the person? Because that's what's, in my opinion, is shifted and is still awry.
Yeah.
But
Well,
that's
we're doing what
choices,
we can,
choices.
and making things available to people to help them make good choices for themselves is really important. So that's what we are trying to do in public health, and educate and guide. That's really all you can do,
No, I know.
in hopes that over time it makes a shift. So.
Okay. I will stop.
Okay.
Any other last things? Okay, I think we're done with that. I do just want to take a second to say I just really appreciate this opportunity that I've had to work with the county, and it has been such an honor to serve our community. We have a really special community. I mean, the heart of service that so many people have, and the collaborations, having our veterans work group the other day. I just think we live in a really special place, and it has been an honor to serve and support this community. So,
We want to thank you for being part of this.
Yeah.
Thank you.
Yeah.
thank you, Ken.
Thank you very much. Appreciate it. And good luck with your future endeavors,
Thank you.
wherever they take you.
Okay. While we're thinking about events, I'm just going to put a plug in for our Public Health Week. Just saying, that's coming up in April. I think we should do a declaration. We did a declaration years ago. Were you? I don't think you were a commissioner at the time. No. It was before the three of you. We did
Well,
a.
I have a before time. when we did that.
I know, but it was after your first round,
my before time?
the second round. Exactly. Anyway,
my
I think we'll
rebirth.
do a declaration. We'll have you guys sign a declaration for Public Health Week
Sure.
when we have that week in April. Because we're going to have an open house. We're going to have a community walk in the evening. What are some of the other things, Katie? Katie doesn't know it, but we're going to try to roust her to come
Yeah, they're
back
trying to
and
get me
help
to
us.
volunteer already. Yeah, we're gonna have something every day. The 4 days that we're open at the health department that week. But yeah, we're gonna have a community walk on the Tuesday night, I don't remember the day, walk run. And there will be some live music, and that'll be at Park DeVita. And then Thursday at lunchtime, we'll be doing an open house at the health department. And then we will also be having a couple of more, I think they're more internal events. One is that the health department is gonna, I keep saying we.
Laurel and I are
guess I'll
going
be
to
there.
give a
Yeah.
luncheon to
Yes.
the staff.
And then there's also going to be a walk that is just
Great.
staff wearing public health shirts, just kind of like getting out and moving and just being a model of that kind of behavior.
Right,
So.
and that's in April. And the health fair, we do have a date set for that. Oh my God, I just got my calendar. Can't remember the dates. It's April. It's 18th. The health fair is April 18th at the Annex from 8 to 12 in the morning.
All right.
We are setting up Friday evening. We will be there at 7 a.m., but it's open to the public at 8 a.m., April 18th. So we actually are meeting with the hospital on Thursday for another planning meeting, and we are set. Don't know costs of what labs are going to be or anything yet, but they're working on that on their end. It's going to be very reasonable for people. And yeah, so that's happening.
All right.
Saturday, April 18th, okay.
Yes.
I hope
Okay.
to see you there.
Oh, you'll be seeing me there. Public Health Week is the week of April 6th.
Okay.
So our open house is the 9th, and the walk/run, which I won't be running, Tuesday between 6 and 8 p.m. Yeah. So, okay, those are
What's
the
the walk
dates.
consist of?
Walkie.
No, I mean, give me a distance. Is it like a,
That's Krista's area. I think
We're going around the
they're
Park
doing
Vita,
the, yeah, whatever they do for is it the turkey trot? Is that
Oh,
what?
yeah, wherever they run for the turkey trot.
I think it's like the
It's
same
Park
route.
DeVita, but then I don't know if they go around
Yeah.
I don't know if they go around Centennial Park or not.
Yeah.
Yeah. So, don't know all the details, but we're gonna have all that guaranteed.
Okay.
Yeah.
Yeah,
got it.
that's
Well,
right.
When you get it all
Well,
ready
the
to
next
go, let me
meeting
know.
is the week of public health.
Yeah.
April 7th is our next Board of Health meeting. So we need to have the declaration signed the week before, don't we? Not that
Yes.
week, right? The week before.
Yeah.
Okay. So.
But keep us informed so we each go to a different municipality and we can announce
And
it.
announce it, good. Yes, yes. So Travis, if we're gonna get it signed a week before, then I need a spot on the 31st of March for a declaration for Public Health Week, the week of April 6th. Okay? Thank you, sir. Okay. What else? Any other big newses? Okay. Can't think of anything else. Anything you want to add, Dr. Hirschman? Anything going on in your world?
Work. No, nothing really to add. But thank you for all the hard work. I agree, it's a really rewarding community to work in. Thank you for all the manpower hours on the measles outbreak, or the measles cases. Maybe not quite an outbreak. Sorry.
Great.
I appreciate all your hard work on that. I'm glad it was minimal and not a lot of secondary spread.
And
It's
we're
pretty
hoping it
impressive.
stays that way,
Yeah.
but we're coming off holidays here, so
And-
we're kind of on the edge of our seat a little bit.
And
So
I
we'll see.
love the discussion about outcome measures and the outcome measures that really matter, like reducing suicide deaths or reducing alcohol-related deaths. Those are all things that, as a public health department, hopefully you have access to some of that data, and I know how difficult it is sometimes to have that. And that as I would love you to be able to bring those in the future meetings to your commissioners who are obviously very interested in seeing that we actually make an impact in the community with the work that you're doing. So but keep up the excellent work. And Katie, I can't wait to hear what you're doing next. I'm sure it's amazing. So we'll take that offline. So thank you, everybody.
Okay. All right. So I think we can wrap it up unless someone has any other
and we'll
questions.
see you next week.
Yes, next week.
Specifically-
Yes, we will.
Specifically with the person that I've been frequenting in your office.
All right, we'll talk about that offline. Thank you all.
Thank you, guys.